Hello, my name is Kevin. I'm a student at McGill College. Today I will be performing a deep tendon skills video. This is for educational purposes that will be graded and viewed by faculty. I have here.
Amalia Vasquez.
Do you consent to being recorded for educational purposes?
Yes.
Okay. So the first thing I'm going to do is enter the patient's room. I'm going to perform hand hygiene, close the curtain for privacy. I'm going to introduce myself, and then I'm going to verify the patient using two patient identifiers, name or armband. I'm going to explain the procedure I'm going to be performing. Today I'm going to be performing a deep tendon skills reflex. What this does is it tests reflexes on 4 different parts of your body: your bicep, tricep, patellar, and Achilles. What this does is it elicits a response that we as nurses assess for. So this skill can actually be performed on any individual, but it should be performed on pregnant women to assess for pregnancy-related complications. For example, if I were to test the reflexes on the patellar tendon and there was hyperreflexia, that would indicate preeclampsia. So the first thing I'm going to do, this is actually measured on a scale of 0 to 4, 0 being absent, 1 hypoactive diminished, 2 regular, 3 hyperactive brisk, 4 brisk and clonic. Alright, so I'm going to first ensure that the patient's arm is relaxed and supported. I'm going to get my hammer and use the pointy side. I'm going to tap on the biceps tendon. That should elicit a response. Next, I'm going to have the patient bend their arm, ensure that it's relaxed and supported. I'm going to locate the elbow bone above that. I'm going to use the pointy side of the hammer and tap. That should elicit a response. For the patellar tendon, I'm going to ensure the leg is relaxed. I'm going to locate the knee bone, and then below that, I'm going to use the flat side of the hammer and I'm going to tap. That should elicit a response. Lastly, I'm going to assess the Achilles tendon. The patient's foot will be dorsiflexed. I'm going to use the flat side of the hammer and tap. That should elicit a response. Lastly, I'm going to assess for clonus. So with that, I'm going to dorsiflex the patient's foot. Upon release, the foot should go down normally. So that indicates normal reflex. Now, if I were to dorsiflex the foot and upon release, the patient's foot shakes, that would indicate clonus. All right, that concludes the video for deep tendon reflex. I'm going to ensure that the patient is at the lowest position. I'm going to perform hand hygiene, document that this was completed, and that is it.